Hello. So for this week's journal assignment, I had a recent patient encounter with a female patient. She was 22 years old, and was on her regular follow-up visit. It was a 4-week follow-up. She does have a diagnosis of major depressive disorder and generalized anxiety disorder. The young lady was notifying the nurse practitioner that she had been having some issues at work, and she felt like her anxiety was increasing because she thought that her job was going to let her go. The reason why she thought her job was going to let her go is because over the last, I think, like 6 months, they've been letting a lot of different people go in different departments. And she knew that her department was one of the next ones coming up. And she had been there for 12 years. She's a single parent. And she says she's doing everything on her own. And she's actually an IT major, so she works in IT. And she felt that if she lost her job, she wouldn't be able to provide for herself and her children. One of the great aspects about the nurse practitioner I noticed is that instead of her, telling her the truth, not telling her the truth and saying things like, well, you're not going to lose your job, what I've heard a nurse practitioner do in the past, and tell someone, well, you've been there that long, so I doubt you're going to lose it. Instead, she was honest with her and told her, well, in case you do lose it, these are some of the options that we can look at that you can do next. With you being an IT major, it's good for you to start looking into your future now so that you can avoid that depression that you've dealt with over the years coming back and getting worse, or do something to work ahead of yourself so that you can decrease your anxiety. The young lady didn't have too many other places that she wanted to work, and then the nurse practitioner, I felt like she did some extra things that she didn't have to do, because while she was doing the assessment, she also went online and helped her to look for some more opportunities in the IT field that she could be, I have a code, that could benefit her. She did find a few things that she had even forgot that she had been interested in over the years, and some things she wanted to do when she was younger, and then she later decided that she wasn't interested in because she liked her current job. One in particular was working for a news team, and she was saying that was one of her biggest dreams as a kid. So maybe she should just go back and start back to work towards those goals instead of keeping her head here and keeping all of her eggs in one basket, knowing that there was a high chance of her losing her job. And she knew that her supporting her kids was very significant and very important. So myself, I felt like the nurse practitioner played a very good role in this scenario, because it wasn't about trying to make medication adjustments to keep her less depressed or give her medicine to make her less anxious. It was also helping her to mainly find some other non-pharmacological resources to help her with what she was going through and to put her mind at ease, while also encouraging her to try and network and talk to other people that's at her job, as well as other people in the field that she works in, even by social media. So she did decide to do that. They did find a couple of applications, and I just felt like, to me, it showed a lot of empathy, because I felt like the nurse practitioner wasn't just trying to be like the doctor. She was also trying to support her in a way that, not saying that she has a friend relationship with her, but that somebody would do that supports you as a family member or a friend, because it was beyond just psychological and trying to fix her with medication. I do plan to integrate these tactics in my field of work when I do work as a nurse practitioner, because I feel like it's very significant to have empathy. And I do understand that I feel nurses are very empathetic and sympathetic at the right times, because we were nurses first. So when you're a nurse and you work with patients, you have that hands-on care to learn how to help people and how to make people feel better. So when you transition to the nurse practitioner role, and you also have your medication in your hands and doing all these different orders, you can kind of integrate all of that together. The compassion with the education, as well as the sympathy and the empathy. I don't think nothing negative about that. I do, like I said, it stood out to me because I just felt like the nurse practitioner did great with her, because she made her feel so much better by the end of the assessment by not making any changes to her medication. Not even really adjusting too much to her treatment plan, just helping her find resources and allowing her to remember that she is capable of doing more than just that job. So that's what I got from that, and I felt like the nurse practitioner did a wonderful job. I felt like the patient had a positive outcome at the end of the assessment, and I hope to be able to show some of those same characteristics when I do transition into my new role. Thank you.